This could possibly be an ultrasound.
And what's nice about point-of-care ultrasound is that it's obvious that anyone with very little medical training can look at one of these images and know exactly what's happening.
This is a very high-resolution ultrasound image. And what it shows is that there are black areas and white areas.
I suspect that this may be the gallbladder.
It kind of looks like maybe, I think we're demonstrating the testis here.
Here you will see most of the liver. In fact, probably about all of the liver.
Kidney, baby, it's all in the nether regions. It's good.
I can't tell whether it's male or female. Or maybe it's a gallbladder.
It looks like a normal kidney to me.
This looks like a healthy kidney to me, so that's very nice. I hope my kidney looks like that.
Very good question.
Yes.
Oh!
What are we doing in med school? Seriously.
Jeez Louise, Dr. Weinstein would just love that little baby.
We try to emphasize how they're different from adults, and they're not just little adults.
The baby is retained in the uterus for long periods of time just because they're comfortable. They're just downright comfortable.
Pregnant women are actually submarines for babies when they're swimming underwater.
Now, interestingly, this child has alopecia.
An adult would not fit in a bag full of water like this.
Small gas bubbles leaking from the vaginal area, and it's usually a good indication that there's a happy baby in there.
Sometimes when you fart during pregnancy, it's not your fault.
Now I really don't know what's going on.
I wonder what those little critters are. They look very curious.
These are sea monkeys.
A mouse treated with fertility drugs.
They might be little tadpoles.
Sickle cell anemia.
Little tiny parasites.
Little critters.
Little shrimps, there's a little tail that you normally would, not eat when you bite into the shrimp.
Actually, these are red blood cells that are now sickled.
Lots of small kidneys.
Most professors end with a picture of their kid. I don't know why this one chose to do tadpoles or something.
This is my favorite slide. This is my favorite slide.
Anybody know what this is? What are you guys thinking about this?
I don't know what to say about this.
This is so clear.
This is just a piece that fell off of that. That's all that is.
An ink blot?
Looks like a lump of coal in a Christmas stocking.
A Rorschach test.
It's a Rorschach test.
Rorschach test. Oh. Rorschach test, right?
Really?
Probably most of you are looking at the slide and saying, what the does that mean?
This slide, I think, Hal Manning put in the slide set as a joke.
I think it got in my slide set by mistake.
Once again, is an expression of sexuality and intimacy and how the doctor can help patients think about those sorts of things and really enhance that very important part of patients' lives.
This is a hallmark in medical science.
This is a figure that shows two lines. The gold line is the bottom line, and the red line is the top line.
So this is a graph of a red and a yellow line.
The legend doesn't even...
The individuals who were treated with red had more than the individuals who were treated with gold.
Occasionally, with these graphs that have these bars, there will then be some lines that go perpendicular.
You need an X and a Y axis labeled? Come on. You got into medical school?
But what's important is that you yourself are able to determine what that means.
We can fill in the margins, the x-axes, the y-axes, all of this stuff. Kind of unimportant.
Contrary to popular belief, gold is not the most valuable substance. I think red is.
I guess that shows that things do hopefully get better over time.